let's see about hypertensive disorders of pregnancy. First, let's see the classification. The hypertensive diseases of pregnancy are classified into 5 types. First is gestational hypertension, which is also known as pregnancy induced hypertension. Next is preeclampsia. Third is eclampsia. Fourth is chronic hypertension. The fifth one is chronic hypertension with superimposed preeclampsia. These are the 5 classifications of hypertensive disorders of pregnancy. We will see about one by one in detail. First is gestational hypertension, also called as pregnancy induced hypertension. What is gestational hypertension? It is defined as hypertension which is developing first time in pregnancy after 20 weeks of gestation and returns back to normal within 12 weeks postpartum. This is the definition for gestational hypertension. That is, the woman is not a previously known hypertensive patient. She develops hypertension first time in pregnancy, that too after 20 weeks of gestation, and it returns back to normal within 12 weeks postpartum. So this is gestational hypertension. And gestational hypertension is not accompanied by proteinuria. There is only hypertension but no proteinuria. Next is preeclampsia. Preeclampsia is characterized by increase in blood pressure along with proteinuria. So the hypertension associated with proteinuria is called as preeclampsia. This proteinuria, to be significant, should have 300 milligrams or more of urinary protein in 24-hour urine sample. This is significant proteinuria. Next, in preeclampsia, there will be persistent pedal edema, which is not resolved on taking rest. Normally, there will be physiological edema in pregnancy, which resolves on taking rest, whereas here in preeclampsia, the edema does not resolve even on taking rest. So this preeclampsia can be mild or severe. Mild preeclampsia and severe preeclampsia. So the preeclampsia is said to be mild when systolic blood pressure is more than 140 millimeters of mercury, diastolic blood pressure more than 90 millimeters of mercury on 2 measurements 24 hours apart. Next, proteinuria more than 3 gram in 24-hour urine sample. This is mild preeclampsia. Severe preeclampsia is when systolic blood pressure is more than 160 millimeters of mercury, diastolic blood pressure more than 110 millimeters of mercury, and proteinuria more than 5 gram in 24-hour urine sample, and oliguria present, which is less than 500 ml of urine output in 24 hours. So this is mild and severe preeclampsia. In case of severe preeclampsia, there can be some danger signs. The danger signs include persistent maternal headache, blurring of vision, vomiting, epigastric pain, thrombocytopenia, impaired liver function, renal insufficiency, pulmonary edema, intrauterine growth restriction. So these are all some of the danger signs seen in severe preeclampsia. We will see the reason for each one of this in our pathogenesis and clinical features. So next, coming to eclampsia. Eclampsia is nothing but preeclampsia associated with seizure. This is eclampsia. So the seizures usually are of generalized tonic-clonic seizures, and they can appear either before, during, or after labor. Before labor being the most common presentation. Postpartum eclampsia occurs more commonly within 24 hours of delivery. So this is eclampsia. Next, what is chronic hypertension? Chronic hypertension is when the woman is hypertensive before pregnancy and it continues during pregnancy, or if she is diagnosed as being hypertensive before 20 weeks of gestation. Either she was hypertensive before pregnancy or it is diagnosed before 20 weeks of gestation. This is chronic hypertension. Next, the fifth one is chronic hypertension with superimposed preeclampsia. As the name suggests, there is chronic hypertension who develops proteinuria after 20 weeks of gestation. So this is superimposed preeclampsia on chronic hypertension. So the pregnant women with chronic hypertension who develops proteinuria after 20 weeks of gestation. So this is an overall introduction about the hypertensive disorders of pregnancy, which are classified into 5: gestational hypertension, also called as pregnancy induced hypertension. Second is preeclampsia. Third is eclampsia. Fourth is chronic hypertension. Fifth, chronic hypertension with superimposed preeclampsia. Then a quick recap. Gestational hypertension, also called as pregnancy-induced hypertension, is when the hypertension develops first time in pregnancy after 20 weeks of gestation and it returns back to normal within 12 weeks postpartum, and there is no proteinuria. Whereas preeclampsia, there is increase in blood pressure along with proteinuria, which is more than or equal to 30 milligram in 24-hour urine sample. And there is persistent pedal edema and preeclampsia, which is not resolved on rest. There are two types, mild and severe preeclampsia, and this is the difference between these two. And in severe preeclampsia, there can be some danger signs, which are these. Next, eclampsia. Eclampsia is nothing but preeclampsia associated with seizure, that is hypertension plus proteinuria along with seizure. The seizure is most commonly of generalized tonic-clonic type, which can occur either before, during or after labor. Next is chronic hypertension, that is when the woman is hypertensive before pregnancy or if it is diagnosed before 20 weeks of gestation. Next is chronic hypertension with superimposed preeclampsia, that is a woman is having chronic hypertension but she develops proteinuria after 20 weeks of gestation. So these are the 5 main classification of hypertensive disorders of pregnancy. So we will see about one by one each one of them in detail in our upcoming videos. Thank you.